Hey there, I'm Ingo. I'm a dental technician, a trainer, and a guy who spent more than 15 years geeking out on functional diagnostics. I've taught hundreds of workshops, traveled around the world to speak about occlusion, and rebuilt more wax-ups than I can count. All that experience has taught me one thing. The future of dentistry is about blending solid science, analog craftsmanship, and digital innovation. That's why I built the Functional Diagnostic Skool Community. Why a community? Look, nobody gets great alone. Functional diagnostics is complex. You can make a tooth look beautiful, but if the bite is off and you don't understand how the jaw actually moves, you're setting your patient up for headaches, literally. I've seen patients suffer from migraines, neck pain, and tinnitus because their functional issues weren't addressed. That frustrates me. So I wanted to create a space where we can share knowledge, learn from each other, and push the profession forward. My vision is simple. Build a platform for dentists and technicians who love to learn, who value real-world frameworks over fluff, and who want to master both analog skills and digital tools. This is a place where we honor the work of Professor Rudolf Slavicek and also embrace the latest technology. That's the heart of the Functional Diagnostic Skool Community. Our chewing system is an integrated machine. Teeth, bone, joints, muscles, nerves, everything is connected to our posture, breathing, and even our mental focus. If you mess with the bite, you can throw off the entire system. As dentists and techs, we can't just think about aesthetics, we have to ask, how does this jaw move? How do the joints function? What happens when the patient swallows or speaks? Ignoring that leads to pain, wear, and instability. Functional diagnostics answers those questions. We start with a deep history, palpate muscles, look at joint function, use axiographs and face bows, capture jaw movements, and build models in articulators. It's methodical, it's science, and it's the foundation of everything I teach. A nod to Professor Rudolf Slavicek. I owe a lot to Professor Slavicek. He shifted my mindset. Instead of chasing perfect smiles, he taught me to pursue perfect function. His concepts, chewing efficiency, disocclusion angles, reference positions, helped me understand why some restorations fail and others thrive. He believed in occlusion medicine, meaning that if you want stable results, you treat the whole system. That's become a mantra for me. In practice, that means thorough diagnostics before picking up a handpiece. It means recording the patient's jaw movements, determining their individual reference position, and planning with that data. That approach isn't glamorous, but it's what makes long-lasting results. Analog meets digital. I grew up with wax and articulators. There's nothing like carving a cusp with your own hands. But I'm also an early adopter at heart. Today we have jaw trackers like Zebras and ModJaw that capture the lower jaw's movements in 4 dimensions and export them straight into CAD software. We can simulate real chewing cycles, design restorations that match those movements, and 3D print splints with unbelievable accuracy. That's powerful. What excites me is combining both worlds. You don't have to give up analog artistry to use digital tools. You can use digital data to guide your wax up or to validate your splints. Many of my colleagues either stay in the analog comfort zone or jump head first into digital without a functional foundation. My goal is to help you find the sweet spot between the two. What you'll get in the Functional Diagnostic Skool Community, I didn't create just another online course. I built a support system for serious professionals who want to get better together. Here's what we do inside. Workshops and hands-on training. I'll personally show you how to use axiographs, face bows, and articulators. We'll practice sequential wax-ups and integrate digital data. I believe in showing, not just telling. Webinars with experts. I bring in friends and colleagues from around the world, people who live and breathe nathology, TMD, digital occlusion, and interdisciplinary therapy. Get to hear from them directly and ask your questions. Case reviews and practical strategies. Real patients, real problems, real solutions. We review cases together so you can see what works and what doesn't and take those insights straight back into your clinic or lab. Exclusive resources, members get access to checklists, diagnostic templates, software guides, and discounts on gear. Collectively, it's worth thousands of dollars, but it's included with your membership. Live Q&A, have a tricky case? Bring it to the group. I hold live sessions where we tackle your specific challenges. Community and networking. This might be the most underrated part. When you hang out with dentists and techs who care about function, you raise your game. You'll find collaborators, mentors, maybe even new friends. And here's the deal. We expect you to participate. This isn't a Netflix subscription. Our community thrives on contribution. If you just lurk, you'll miss the point. If you share your experiences and ask your questions, you'll get 10 times the value back. Why now? Right now, the community is priced at $9.99 per month. Once we hit 150 members, the price will jump permanently. Early adopters lock in that low rate. Let's be real, the knowledge and network you're tapping into is worth a lot more. What's the cost of one misdiagnosed TMD case in your practice? A lot more than $10. For less than the cost of lunch, you get a platform that can transform your clinical results and your confidence. I also know time is your most valuable asset, but think about how much time and frustration you'll save when you can diagnose and treat functional issues correctly the first time. Think about the reputational boost you get when your restorations last and your patients are symptom-free. Investing in yourself now pays dividends later. Over the years, I developed a love for photography and documentation. I use images to tell stories and teach techniques. I'm also a tech nerd. I play with 3D printing, AI, and new materials because I'm curious and because I want to be ready for the future. This mix of tradition and innovation is what I bring to the community. I'm a practitioner and a lifelong student. I learn from my peers and from my students every day. That's what makes this community exciting. We're all in the arena trying to get better. My promise to you, I promise to show up for you. I'll share everything I know, good and bad, and bring my network along for the ride. I'll keep things practical and honest. This isn't about hype, it's about helping you master functional diagnostics so your patients get better outcomes and you enjoy your work more. If you're ready to step up your game, to blend analog mastery with digital tools, and to join a group of professionals who care about function, then I invite you to join us in the Functional Diagnostic Skool Community. Sign up now, lock in the introductory price, and become part of a movement that honors Slavicek's legacy and shapes the dentistry of tomorrow. I look forward to meeting you, hearing your questions, and growing together. Thank you for listening, and I'll see you inside the community.